Well, hello, everyone. Hope you are doing well on this Good Friday. It's now your turn to ask the questions you want answers to regarding COVID-19. Today, our guest health analyst is Dr. David Schultz of Evansville Primary Care. Dr. Schultz, Lisa from Sturgis, Kentucky has this question. Can you have it more than once? Is there more than one strain of the novel coronavirus?
Well, right now, the current thought process is you will only get this once. But there's still a lot of uncertainty. We have to see how our antibody response does and how long those antibodies last. It's the antibodies that gives us memory in our body for this particular infection to allow us to mount a secondary response if we get exposed again.
Laverne is asking if we are advised to start wearing masks and gloves, and there aren't any in stock. What is one to do?
Well, certainly I would ask around. Some people have extra because they bought extra, and a lot of people right now are willing to share. But if not, you need to make your own. It's best to use a double layer of fabric and so forth. And remember, if you're going to make your own either with a bandana type, then what you would do there is wash it at the end of the day and keep it clean. The other thing is there's a lot of online processes of how to make your own homemade mask, and a lot of these are good and are effective in at least reducing the amount of exposure.
My question now, Dr. Schultz, of course we're worried about our kids, but we notice numbers are relatively low for children under the age of 10. Why is that?
Well, there's several reasons. First of all, we've practiced a very excellent job of social isolation and distancing. And we know it's when kids are around other kids that are infected is how it's going to be spread the fastest. But the other thing to consider is the lining of the lungs in kids and the respiratory tract is slightly different than that of the adults, and where viruses and also bacteria, as far as that's concerned, attaches itself is often specific to the age. So it's age and then also the amount of social distancing and isolation we're doing right now with our children.
And one of our viewers, Ray, asked, can you get it from others who are in your family, whether they be in quarantine or not?
Well, certainly if you're around another family member, Brad, that has this, then certainly you're exposed. But if you have another family member living a distance away and you've not been around that individual for at least 14 days, then you cannot catch it from that family member long distance. But if you've been around that family member again, then you could catch it from that family member who already has it.
Saw this item last night. Research is showing fewer people are heading to the emergency room for heart attack symptoms because they're afraid of catching COVID-19 there. What's your reaction to that?
Certainly the regular medical problems that affect us are still going on. We're still seeing people with acute myocardial infarction, COPD, also diabetes, and we still need to treat those problems. If you have chest pain, the first thing you should do is take a full 325 milligrams of aspirin or 4 baby aspirins. Call 911 if you're having chest pain. If you're not having active chest pain, then either call your physician or go to the emergency room immediately.
And Jim is asking, where could someone go in the tri-state to get prescription for hydroxychloroquine? If you're using that drug, does it have any kind of an impact on COVID-19?
Well, certainly hydroxychloroquine, which is also known as Plaquenil, is being studied right now. And we think what it's doing is helping the secondary phase of this viral infection from causing its havoc. The reason is because it works as an anti-inflammatory. And about days 5 to 9, when the viral itself is losing its viral load, the body's immune system starts taking over, causing pulmonary congestion. We believe that this medicine is blocking that reaction from occurring, which is helping recovery efforts. And so to find this medicine right now is very difficult, and that's because it's being used in areas that are being heavily hit, like New York and New Jersey.
And I know this is a question I didn't share with you earlier, but I'm sure you've got a reaction to it. You know, it has been billed this week as the worst week in some people's lives. After seeing what has transpired, and we're at the end of this now going into the Easter weekend, how do you think we have come out of this week in particular, and how much of an impact will that have on what we are to face in the month ahead?
Well, certainly right now, everything's being met with optimism around our heartland. around our nation. And that's because we have slowed the rate down, and we have to be very optimistic and prayerful that that continues. Hopefully that rate of increase will continue to decline so it levels off and we start seeing fewer cases. But remember, there's over 500,000 people in America with this infection right now, and those could get worse over the next week. And I think this week is going to be the week to help determine if we're going to see a continued decline in additional cases. At least the rate of decline should be less. And then hopefully we'll be able to learn more about how to keep this virus from taking a person's life.
All right, Dr. David Schultz, thank you for being there for us. And you, by the way, stay healthy too.
Absolutely. Thank you.
Well, Monday on Coronavirus House Calls, I'm joined by Dr. Louis Cady. He is a psychiatrist and founder of Cady Wellness Institute to talk about the emotional and mental stress COVID-19 is causing. Drop me a line on our Eyewitness News Facebook page, letting me know what questions you want answered, or you can reach me on my Facebook page.